I'm Julia. I'm a craniosacral facial therapist and I love working with young babies and children. And this is Ronel, and she teaches parents how to massage young babies and children. One of the big buzzwords these days is certainly stimulation, and I see parents are very dedicated to stimulating their children. But a real factor is overstimulation. Just bombarding the nerves and the senses with so much information is not helpful to children. I think the average modern adult frequently struggles with overwhelm, and certainly it's a factor for children as well. So let's talk a little bit about what we can do to prevent overstimulation and what causes overstimulation, specifically in massage.
Yes, it's true what you say, Julia. We each have our own threshold for certain types of stimulation. And babies are exactly the same. So some of them may be able to tolerate more visual stimulation, some of them may be able to tolerate more tactile stimulation or more auditory stimulation. So it will depend on the individual baby what is going on in the room. Because, when they come into the class for the first time, it can be quite a stimulating environment for them. There are other mommies, there are other smells, there are babies who make noises. There's just the normal background noises as well. And then, in our classes, we usually like to decorate a little bit with pictures and so on. So it can be a lot of stimulation for a baby in the new environment. So often it takes a while for the baby, after the second or third or fourth class, they become used to this new environment, and it's easier for them to tolerate more massage inside the classroom. But at home, we advise that parents massage their baby in an environment that's familiar to them. So something that they know already well. They know the smells, they know the lights, etc. So we do not want to have a lot of visual stimulation in the room or a lot of auditory stimulation in the room. And as the babies grow older and they are able to tolerate a little bit more, that it might be easier for them to be massaged in a room with more stimulation. Often when babies grow a little bit older and they start to move, it's a little bit more difficult to have them lie still for massage, and then we may even need to give them something like a toy or a little book or something just to keep them occupied for a little bit of massage. The older babies may also enjoy being massaged in the bath, and for a younger baby to do massage in the bath may be way too much, because bath time is a stimulating experience for them as well. Babies may not always display the symptoms of overstimulation immediately. Sometimes there may be a delayed reaction. But when the baby is overstimulated, and if the baby shows us, then of course that's the time to stop. Even if we have not completed all the massage we were planning to do, it's still very important to stop when the baby shows disengagement.
Yeah, I think the rule of thumb, whether it's therapy or massage, is less is more. Let's start quiet, gentle, including in the space the adult is in. Quiet, gentle, focused, aware, less sounds, less movement. It's a rare thing for all of us these days. Start working with the child, and it's a great way to get to know them, get to know where their thresholds are. And special times are not usually in noisy, chaotic, busy environments in any relationship. So let's build that into the experience. Again, in the case, if you're coming for a therapy session, sometimes the child will come with the nanny and the granny and the grandpa, and it's absolutely wonderful. And children are different. Sometimes having all four people fussing and saying gugu gaga is familiar to them. That's how it works in their house, and it's comforting to them. My role is to manage that so that the child can give us the information it needs so we can do the work. What's a great advantage of having extra grannies or parents or carers in the room is that they're also able to absorb all the information I share and go home and discuss it. But if we have to, we'll take photos. So overstimulation is far more the pace of the modern child, and for all of us, than understimulation. Rather a little bit of excellent stimulation at the right time than overstimulation. So it's an important thing to keep into mind. At the end of a busy day, when you're overwhelmed and the baby's tired, maybe not the best time.
I would like to add to that, Julia, because often parents say, what if I go back to work? There will not be time to massage my baby. I come home so late and so on. You always have time, to bath your baby and to feed your baby. And that's why I want to also reassure parents that massage doesn't need to be 15 minutes or 20 minutes or 1 hour or whatever. A 1 minute massage or a 2 minute massage may make all the difference, because it's not only about the technique, it's not about the rubbing of the baby, it's about being with the baby and looking at the baby, smiling at the baby. That's the time for reconnection. So even if it's only 1 minute or 2 or 5, that's also good enough. That's a beautiful way to end your day and to reconnect with your baby after a long day of work.
Beautiful. Thank you.